என்னுடைய பேர் வந்து I'm Dr. Devanathan. I'm a retired consultant physician based in London, and also I am one of the trustees of Global Friends of Moolai Hospital. Then we have got Dr. Surendra Kumar. He's the current Dean of Medical Faculty, Jaffna, and he's a consultant community physician and a senior lecturer in the Department of Community and Family Medicine, Medical Faculty, Jaffna. He's the medical superintendent of Molar Hospital. Then we have got Dr. Sangarapula Manoharan. He's an emergency room physician and an administrator. He's based in California. He works for Kaiser Permanente for more than 30 years. He has been working for this institution, and which is the largest private medical group in the US with more than 16 million members. Then Dr. Shankar is an academic physician based in London, and he's a trustee of Global Friends of Moolai Hospital. And then Dr. Puloganathan, who is a retired general practitioner from London, and also he's the director of Institute of Family Medicine, Sri Lanka. He's at present in Sri Lanka and traveling between Jaffna and Colombo. So hopefully he will also join in our discussions. Okay, I'm going to give a very brief history of Moolai Hospital. Moolai Cooperative Hospital has been founded in 1935 as a family medicine center. It was founded by Dr. K. Kanagarayan. Apparently he was born in Moolai Hospital and trained as a doctor in Calcutta, and later on he went to work in Singapore and Malaysia. And when he retired in Malaysia, he decided to return to Moolai with a view to providing a much needed quality healthcare for the local community free of charge. So he's the founder of Moolai Hospital. I'm sure most of you will know where Moolai Hospital is. It is in Moolai village on the road between Jaffna and Karanagar. Moolai Hospital, the previous slide, please. You move on. Moolai Hospital is the first cooperative model hospital in Southeast Asia, and it is a non-profit organization. And this hospital has created a cooperative history in the sphere of health sector. Because of its phenomenal success, it was able to obtain a charity status in 1953. This institution has always been administered by a committee of volunteers. At present, the chairman is Mr. Gyaneswaran. I'm sure he is here today, and 12 other board members, including Dr. Surendra Kumaran, who is our medical superintendent. Moolai Hospital board is charged with day-to-day running and administration of the hospital, and they are accountable to and independently audited by the Commissioner of Cooperative Department. There's a membership scheme, and if any of you wanted to be a member of Moolai Cooperative Hospital, you can fill in a form and apply for membership by paying rupees 120 one-off fee, and your membership will be reviewed at the following annual general meeting, and you will be admitted as a member. And any profit made by this hospital will be used to enhance the services provided the hospital. It will not benefit any of the members. Next one, please, Shankar. And just to let you know what happened during the recent civil war. This hospital was bombed in August 1990, and although it was bombed, they were able to provide some service. But between 1990 and 1995, there were more bombing, and in 1995, they had to abandon the hospital as everybody was fleeing. The board members, the community members or neighbors, everybody was fleeing, so they had to abandon the hospital. However, they returned in late 1996. Lots of people returned to their own homes in 96, and the hospital was re-established there. Next one, Shankar. And so obviously with the bombing and also the neglect, the hospital needs quite a lot of refurbishment. And part of the hospital has been refurbished with the help of some well-wishers, and it requires more refurbishment. And there's lack of modern equipment, and also lack of doctors, nurses, and healthcare assistants. So we need lots of improvement to be made to this hospital. Next one, Shankar. And the services provided, I'm not going to go into any of these details because Dr. Surendra Kumaran will be talking about it. So what we provide is listed there: family medicine, emergency services, although it's very limited. Then there are specialty clinics, consultants from Jaffna Teaching Hospital attend these clinics, some minor surgery and cataract operations, laboratory service. This has improved recently, and they are able to provide very good laboratory services at present. And subfertility services, that's something new. It has been developed. I think Dr. Surendra Kumaran took a big interest in this, and he has been developing, although the services are very limited, but there is some service. I'm sure most of you are aware of the situation there. If anybody wanted subfertility services, they had to travel. Most of the people end up in South India and spend lots of money. Then there's a very good elderly care services as well. Next one, Shankar. So emergency services has to be redeveloped. Although there has been some improvement made recently, and we have managed to buy some equipments as well. I must say a big thank you to Cara Welfare Society based in UK. They were able to help us to buy some equipments, but at the moment there's lack of staffing, and also the services are still limited. Next one. And I'm sure Surendra Kumar will give you details. Same thing with operating theatre. It needs a lot of investment and refurbishment, and equipment need to be bought. Next one. Shankar. Okay. Okay, subfertility service. I'm not going to elaborate on that. As I told you earlier, it is a limited service, and Dr. Surendra Kumaran will again tell us. Yeah. So we need lots of redevelopment, and immediately we need to develop satellite clinics and also training of healthcare assistants. That's happening at the moment. I think Dr. Pulo has taken an interest along with Dr. Sangar, and there has been some training going on, although it was disrupted because of the recent pandemic. Then the laboratory services has improved, and emergency services, operating theatre, and subfertility clinics need to be, it needs further investment. Next one, please. Okay, so these are just needs, long-term needs, like modernization of the operating theatre, elderly care, and also getting accreditation for family medicine, and purchase of, I think they have already got a couple of ambulances from Japanese embassy, I think. Okay, next one, please. Okay, what we need is funding, and I'm not going to touch this because I believe Dr. Manoharan is going to talk about that, so I'll skip that. And next one, please, Shankar. And just a few words about the global friends of Molar Hospital. I think this was launched in October 2019, and it is registered as a not-for-profit limited company in London, and we have opened a bank account as well. We are now ready to recruit members for this initiative, and Dr. Sangar will elaborate on that. So I'm going to stop here. Thank you very much for listening.
Community hospital is a 5-acre land and another 5-acre without any building and thing, which is, and the buildings and other properties belong to the community. It's owned by the community living over there. So that is what that we need to ensure these things are happening in a great way. So I apologize my slide because of my busy schedule and thing. Then I some of the things and maybe not complete. So I apologize. And if you need any more details, and we are very happy to provide. So I'm thinking that why we have to. I want to present, and after this, Dr. Deva and Dr. Manohar and then Dr. Pulo and then Dr. Shankar are going to do. I want to quickly do that presentation. So a need for MCH, what we can to develop it, and what are the progressive, what are features, and show you that particularly how this healthcare service can provide service, because there are gaps that couldn't be provided by the state. And also we need to improve the quality of life of the people. And good thing that Dr. Devara, Mr. Devara, Engineer Devarajan was telling, when does people like you come to Sri Lanka or maybe then in Jaffna, when you get ill, whether people are ready to go to some of the healthcare institution. The Jaffna hospital, you know, these open wards with the crowded patients, and then we need some other place to cater the need of people coming from various part of the world. Then only then we can promote the people to come and stay, do their work there. At the same time, also, you know, there's our 68% of the diabetic patients not having a good control, and 75 to 80% of the hypertensive are not having control. So there must be a need for these community-oriented primary healthcare services to achieve that. And also, you know, this increasing surgical need, and then the state hospitals are having limited surgical facilities. So then most of the patients are forced to go to the private sector, and then, or otherwise they need to wait for a longer period. And so then this kind of a hospital, community hospital, can provide the services to meet that. And particularly, we are very keen, and we are also having kind of a discussion at various level with the present governor of Northern Province and Professor Alkumaran, and thing where we can set up this one of the need to set up a IVF center, the fertility center. So with the problem that the government sector, even in South and global experience, it's not possible to have the fertility center in government sector, because you know that every cycle the patient needs the cost of around 300,000 to 400,000. So that is not possible in the state sector to afford. So then we can also allow these people to depends on the this private sector. So then private sector cost and things are maybe not affordable for the poor people. So then that's why then we are very keen to develop that. And then third thing is like geriatric care, rehabilitation, and those kind of thing also. Particularly, you know, this services trying to provide some of the long-term living nursing homes, so that with nursing and medical facilities, that is the growing need, and particularly when we are getting aged population, the nursing homes, and also then some of these home care services. So empower the people living around the village. That is the fifth objective, is when this hospital is operating. Now it's able to provide job opportunities for more than 60 people to continue this their family. So they get a regular monthly income, which is helping them to run their family. So then we can empower. That is directly I'm talking, and indirectly. So this hospital at the moment is able to provide around 120 people to have a good life. And when we develop this more, and then we create more job opportunities, and then also people will be empowered more. So this hospital renovation, then they started and they divided this into 3 phases. And first phase really the revitalizing the clinic section, the primary care and outpatient department. This process really started by Dr. Rajasundaram and his family members. So he spent around 75 million to service that place. And then phase 2 surgical complex and the operation theater facility really, and then and the emergency care. So already that, as Dr. Deva mentioned, the emergency care equipments donated by Care Development Society. The emergency care is very important in this week, particularly the hospital where it is situated, from Karanagar to up to Chankane, and then Raleigh to Madahal. They have to rely on the Changana hospital, most of these emergency care service. Otherwise, they need to go to Jaffna hospital. It is 16 kilometers away from these villages. So these village people, most of the time they bring to this hospital emergency care. But still this hospital is really struggling to provide a good quality of emergency care. Earlier we were struggling to get that hospital equipment and building. Now that equipments, we got the support from Care Welfare Society, and then the thing is board actually spent around 2.7 million to renovate the building. So now all these things are there. We got 2 emergency physicians, husband and wife. They came after the training, they came to Sri Lanka and then they stay with us. But after COVID and thing, they decided to migrate to UK. So now we don't have a kind of emergency physicians to support, but only we have things with the support of our medical officers. And also we have the issue of the ambulance. We got earlier donated by the Northeast Provincial Council, when the Northeast Provincial Council was available in 2007. So we used that ambulance, and one of the this family, our Vice President, Mr. Manunidi Aputhurai. So Aputhurai family, they actually renovated the ambulance, but still the ambulance get breakdowns and things. And Japan Embassy promised this ambulance donation. We got 2 renovated this reconditioned vehicle, this ambulance, and already Japanese Embassy gave the money to Moolai Cooperative Hospital, but the money is in the bank. Because of this dollar issue, bank is not ready to transfer the dollars back to Japanese charitable organization for them to make the ambulance and send back. So now that we are kind of negotiating that kind of a LC document to provide this NGO to get this ambulance. So these ambulance, 2 vehicles come, one is will for the emergency, another one for the home-based care and then community care that could be utilized. That is thing. And operation theater, particularly Manidaneyam Trust, helped us to renovate the operation theater. So they provided around 6 million rupees to renovate, and then now we are able to do these eye surgeries. But other minor surgeries, the problem we are facing some of the equipments, we want to get it, but that we now decided to hire the equipments and do the surgeries. So they need some capital to improve the surgical facilities. And also we have a good staff quarters for nurses, and also as mentioned, then rehabilitation, and then the fertility alleviation, all these things that they identified. These are the needs by the hospital board and the management. So particularly this accommodation for the elders, at the moment we have the accommodation for the elders. That care also, there are a lot of challenges. We have a kind of training of staff, the managing the human resource. Those are the things that we really struggling to provide a good quality of service. So and also we want to work with this data technologies and things. So Arocare Life is at the moment the software developed by the local people, that local company, and then engineers from Jaffna, which is also used by the hospitals like EMAS and other hospitals in Colombo. Now it's available in Moolai. And also we want to improve that, as I mentioned, that economical development of the people living around. So I want to highlight some of the things and show which departments doing progress. Particularly, you can see in the laboratory services, we have started, and now that some of the way that laboratories are providing services, we get samples from various places. And we also opened one satellite clinic with this in the main street, Jaffna, that actually Institute of Family Medicine, that the Family Medicine Trust run by Dr. Puronath and family. So that building we have been using and started. So we could able to expand services there. And also another concept we introduced recently, that the Sukampernam Nilayam, that make the people, the community to make the people healthy. The Suham is healthy, the typical Tamil, because we want the people in the village to healthy. So these are nurse-led clinics, particularly supported by the community. So we started the first Swamperna Nilayam Center in Vatukotai, November 6. Vice Chancellor Yunus Jaffna opened the Swamperna Nilayam, and then now we are able to run the services. There are 150 people registered there, and we are planning to open the second one in Karanagar, and third one in Erali, and fourth in Kandataripu. So like that in the villages. So this Vatukote Center is supported by the Vatukote community. They form the community, and from Canada, UK, and Australia, they are the people supporting these clinics. So the people walk in and check their blood pressure, blood sugar, and also get kind of advice about their diet, exercise, and things. Also, so other problems, also mental health, and nutrition, and all these things. So there are two nurses, one retired nurse from teaching hospital, and one healthcare assistant. Those two people are there. The clinic is open from 7 to 10 in the morning. So in the evening, 4 to 7. So then they can walk in. One of the physician visits voluntarily once in a month and see the patients, and doctors, the medical officers, they visit once in a week. Now we are also planning to develop some telemedicine facilities. So then doctors all over the world, they can come. Those who are living in Vatukote can come and do some free advice and counseling, and then mental health support, and or maybe disease control. So that is what we are working. So then here, then in the particular laboratory, you can see that laboratory income is progressively increasing. Then the 2020 we had whole year. Our financial year start from April to March 31st. So then whole year we generate 2.6 million, and then 2020-21, you know, this pandemic time, it's about 2.5, and then again now up to January we could able to make turnover of 5.9 million. So this time we could able to make around 7.5 to 8 million. That is our target. So, and you know, this fertility services. Now we started the fertility services mainly in the Institute of Family Medicine MCH clinic at the Jaffna. Dr. Sarana Bhavan is seeing the patients. Particularly Dr. Jayendran from US, Chicago, he is running his andrology lab. He's an andrologist. So he is supporting us to set up a good andrology services. So at the moment, we got this fertility service things, and you can see how services and things are progressing. And then we started last year, March. So then you can see the figures from May to up to now. These services are improving, and we are able to expand more and more. Now we got the facilities at the main hospital, Fertility Center, and also doctor, it needs 50 million Sri Lankan rupees. Dr. Jayendran from US is able to mobilize around 15 million. And then we are able to we need to find out another 35 million to set up a good fertility center. So that will be the center for whole northern province, and even patients coming from all over the world also we can cater, particularly for our people. So now we are in the process of raising 35 million rupees to generate the income. So generate the thing to set up a fertility center, and also we provide through the Thaimai, the hospital contribute. We have a Thaimai fund, so then we provide free and then the services in concession rate. We are able to generate around 2 million fund, and that fund is kind of a whenever the patients they make the request, and we screen them and provide free services. So that is happening through the Thaimai services, particularly for the fertility. So we want to concentrate more and develop these fertility services as a second thing. Third thing, that our pharmacy services. Now our pharmacy is also we are able to improve the sales. So we want to give the drugs in the affordable, low cost. So we usually make that kind of a small profit, and then we run this. So this pharmacy services also now promising, and then we could able to make. So we want to strengthen more and improve it further. So we are thinking that to focus more pharmacy, elderly care unit, laboratory, fertility services, inward services. When we are talking about inward, and particularly for deliveries and Sangaini, and also the surgical services. So then we could able to provide more services. But as I mentioned, that Sukampurnam Nilayam, and also now we are running a Diabetic Center supported by Ratnam Foundation. Really, Ratnam Foundation started in 2005 in the vision of having a good center to provide free diabetic care services to people living in around. So now we are able to provide that, and with the support of multidisciplinary team, nutritionist, diabetic nurses, counselors, social workers, and diabetic center, and Diabetic Center at the Molar Cooperative Hospital, and also we are expanding that services to the community through the Sugampanam Nilayam. You can see more details when you go to this YouTube video we produce about the Thai services, and then various leaders in the region, Professor Balasundaram Pillai, Dr. Arthur Umur, and all mention why do we need kind of a Thai kind of a services and center to develop and provide good services. So this thing and further discussion, and Dr. Manoharan will expand more. We want to get more funding mechanism to strengthen these services, and also we are in the process of discussing with the cooperative minister visited the hospital, and they have this in the country there are about 13 cooperative hospitals. The southern cooperative hospitals are doing well. The Kurunagalam, Matara, Goal, all these hospitals. So they have a cooperative hospital federation. So their cooperative hospital building in Kalpiti, they had the meeting, and then 2 weeks back, so our president and 2 other members participate that meeting. So really the cooperative department and the Minister of Cooperative Development, they are expecting us come up with a kind of a business plan, particularly plan to expand our services. So they are very happy to provide the low interest loans through the corporate department to develop these services to provide to the community. And we are trying, we need to strengthen the board. So most board members are, so board is a voluntary one. So most of the board members are above 60s, and some of them are more than 70, and with their aging and other problem, and they are really contributing to run the board. But we need more young people spreading the age from 30 years to 60 years. So more people from the community to come and expand or improve the services. So that not only then hospital, then it was kind of a well-functioning hospital before that, but now there are a lot of shortcomings and issues that to hospital provide service. So that's need to be rectified, and then they have a kind of a strengthening and also membership. So the Kurunagala Cooperative Hospital, they visited a few weeks back. They said they have 41,000 membership to the hospital. But Moolah Hospital had more than 4,000 members, 4,000 to 5,000 members. But now only active members just closer to 300. So we need to improve more membership, more community people to get involved, and community participation is very important. And then hospital should have a kind of a strategic management plan, how we are going to move in next 3 years or 4 years, and then working plan. And also it is very important to have a mechanism, regular feedback to the particularly well-wishers all over the place, and they have contributed a lot, and still people are contributing, but the regular feedback things are not given to the donors. So then we need to improve that also. So thank you so much. Then Dr. Manoharan will talk why do we want to set up this kind of a global Friends of Moolai and to expand it. And then Dr. Shankar will tell then how this this forum of Friends of Moolai will operate. Thank you so much.
I think including me, when I started this many years ago, medicine is a profession, okay? And most of the doctors who are trained in medicine are not taught the business side, okay? So there is a definite distinction between a profession and a business, okay? Sure, medicine is a profession, but we are in the healthcare business, okay? So there should be a distinction between a business and your profession, okay? So most of the doctors not given training in how to run a business, and medicine, you know, whether you like it or not, it's a business, okay? So I think that's the first point, okay? So whoever runs the hospital, the management should have a very astute business sense, okay? You know, how can I run this hospital, and how can I, make it more profitable so that you can expand the service and take care of your local population, okay? I believe right now Moolah is run as a charitable hospital, but I'm not too sure because I've been with Moolah only for the last couple of months, okay? I was there for the very first time in December, so I really do not know the nuts and bolts of the Molar Hospital. But my suggestion is to run this as purely a fee-for-service, okay, non-profit and value-based, okay? So you run it as a fee-for-service, okay? Then you must also capture, I'm told Jaffna gets about $10 million every month from abroad, okay? So generally the population would spend about 10% of their income on health services, okay? So 10 million they're getting, so you get about $1 million that the public has to spend on the healthcare. The question is, how much is Moolai capturing? Okay, so that is for you all to decide about it, okay? Charity is very noble, but charity, if you don't have proper finances, you can't do a charitable work. So in my group, we are purely fee-based, non-profit and value-based, and we allocate about 10 to 15% for charity so that we don't charge patients, okay? The rest is all run as a fee-for basis. Then, in healthcare business, there is something called resource mobilization. This tells you how the health system, for example, how Moolai Hospital will generate and collects revenue, okay? The second part of it is the pooling, okay? Combining financial resources from multiple sources to share the financial risk of paying for healthcare, okay? So that's the second bucket. The third bucket is a purchasing, okay? Mechanisms to pay for providers for healthcare services, okay? So the first bucket is you bring all the money into one pool, okay? That you need to figure it out, okay? How am I going to collect all this money revenue, okay? The second thing is, once you collect the money, you're going to analyze, okay, your financial risk of paying for the healthcare. And of course, the third bucket is a purchasing mechanism, okay? From what I understand, Moolai Hospital has several buckets, okay? If you look at can you go to the next slide, please? Next slide. So these what I said, resource mobilization, then pooling, and then the purchasing, okay? So these are fundamental in any healthcare business, okay? Next slide. So right now, if I'm correct, you have multiple buckets in your operation, okay? So you have outpatient, okay? You have lab, you have radiology, you have, if I'm correct, pharmacy, elder care, and of course, you have some surgery, as the Dean mentioned, but not a full-fledged services, okay? So you have to sit down and think, okay, out of these buckets, okay, which is where you can expand, okay? As the Dean said, lab is a very good source of revenue, but the question is, instead of people coming to you, you must take the lab service to the people, because in Jaffna, the transportation is costly, it takes time consuming, and most of these people are either middle class or low middle class or even poor. Can they travel 16, 17 kilometers to the Moolai Hospital? So I'm glad to hear that you have a collecting center in Jaffna, and your revenue in the lab is slowly going up. So you need to expand that, and also maybe now that you have one in Jaffna, think of another lab in another place, So lab is one area that you can think and expand. Okay. The second thing is pharmacy. Pharmacy also brings, as the Dean said, the people are poor there, But pharmacy also, there's a good margin in any pharmaceutical business. When I say margin, I mean profit in medical business. We never say profit. That's a dirty term. So we use the term margin. Okay, so again, you can expand your pharmacy, but just go outside Moolai. Why not put a pharmacy near the hospital in Jaffna, the main hospital in Jaffna, along the main street or one of those smaller streets, and capture that market as well. Pharmacy is a good business, and you can get quite a good margin on the pharmaceutical business. All right. The third thing is elder care. As Dean said, I've seen the elder care at Molar Hospital, which is pretty decent. Whether you can expand the elder care inside the Moolai Hospital and also just outside. Okay. The other market is surgery. There are a lot of Sri Lankans actually go to India, either to Chennai or to Vellore for specialty care, especially on knee replacements, arthroscopic surgeries, and eye care. Okay, Moolai Hospital needs to think whether they can expand on this particular aspects of the surgical services. Okay, I know a lot of people from Jaffna go to either come to Colombo or go to Chennai, mostly for knee issues. Okay, so that's another thing that you guys can think of. Okay, the fertility care is also very good. I know Dr. Jandran very well. He's a good friend of mine from Chicago. He's one of the top-notch andrologists in that neighborhood. So I'm glad that you are getting his help to expand the fertility care. Okay, next slide. The other one is, right now you have your outpatient care only at the Molar Hospital, okay? As I said, transportation is a problem. Cost is a problem. People have to spend half a day or maybe even one whole day just to come to your place. So right now over here, what we have done is, the whole concept is taking the service to the people as opposed to serve people coming to the hospital. So we have started putting clinics, medical clinics inside these retail stores. I'm sure some of you all know the Target and Walmarts, okay? That's why there's a lot of foot traffic. A lot of people go into these places to buy their groceries and, the household products. So it's a one-stop, one-shop for the people. And these clinics are manned not by a doctor, by a mid-level provider. Over here, we say nurse practitioners or physician assistants. And it's really growing, and we make a good margin, and the cost is kept low. We provide simple like hypertension screening, immunization, cough and colds, pediatric issues. So the patients are very happy. Anybody can walk into this clinic, and we do have a billing system, and either it's a cash payment or it's a credit card payment. Okay, so Moolai Hospital can think of doing something like that. You have a big food city right opposite the Jaffna Hospital. Why not think of a small clinic at inside the food city where there's a lot of foot traffic? Okay, I think it's a win-win situation for both the Molar Hospital and also for the food city. The other option is to, we do a lot of student health clinics. Okay, we put these clinics inside major universities and we take care of them. And you have a big campus in Jaffna in Tinnavelli. I don't know where these people are going. The student population goes when they have issues. Okay, so if you have something inside the Jaffna campus, it's going to be very convenient for the students as well as for your business as well. Okay. So, so my talk is going to be just a brief talk. They told me not to spend more than 10 minutes. So those are the ideas that I have. The other thing that I want to tell you is to run your operation like a business operation. My suggestion is to hire a CEO. CEO. It doesn't have to be a doctor. It can be a guy with a business background, and give him some goals and give him 3 years and ask him to reach the goals and pay him. Okay. I know the CEOs cost a little bit they're costly. I'm told that they, anywhere from 2 to 3 lakhs a month, so that's for the board to decide. So that's a brief presentation. Somebody asked me for a business plan. But for me to do a business plan, I have to come there, that's what we do over here. We spend at least, a week to 2 weeks at the clinic. We talk to different people and then come out with an actual business plan. So this is just a brief presentation from my side. Again, I just thank all the board members and Mr. Devarajan, Dr. Theva, and the Dean for giving me these opportunities.
Hello, good afternoon, good evening, and good morning from all of the people that from Sri Lanka. It's good afternoon. And then I've done, because Dr. Pola and they asked me to do this presentation on development of the community-oriented health services, which Dr. Suren that just he has gone through in details. As you know, the Moolai Cooperative Hospital has started the history of it and gone through in details by Dr. and the others. So I will touch base mainly about Friends of Moolai Hospital, and also that I will go in details about future collaborations with Indian-backed organizations, which they are willing to work with us. Also, signed memorandum articles to provide services. Okay, Moolai Cooperative Hospitals, I thought many of you know, and if anyone not aware of it, it's in Jaffna, that is next to, for outsiders coming from, without our backgrounds, next to India and in the tip of the Indian Oceans. We got Moolai Cooperative Hospitals there, and Memorial Green Hospitals there with the Dr. Sridhar's well family. And the satellite clinics we were talking about is on the main street, Jaffna, if you guys know that. The hospitals, also main hospitals there, to illustrate where the logistical locations are. And here, Global Friends of Moolai Hospitals that formed in 2019, we discussed in details with Dr. Ratna, Dr. Pulo, Dr. Suren, that came up with the idea that Dr. Pulo and Shankar just you need to fundraise and things, and along with the trustees of Moolai Cooperative Hospitals, and it's we attracted few people, Mr. Chelian that from Ola Tamil Panbata Kalaham, and Mr. Veluplai that is accountant, volunteers, all volunteers. No, none of us get paid for these services. And then so we are doing voluntary work. And officially it was formed in 2019 and then registered, and then now we got as a not-for-profit limited company in 2021. As a trustees, the main board of trustees are myself and Dr. Theva, to make it simpler, and then all accountability, so all the funds generated will be administered by the Moolai Cooperative Hospital trustees. So every penny will be accounted, so will be accountable. So that as we speak now, we are it's a membership-driven charity, and then just we are pending registrations. We are working on the Charity Commission registrations. As we know that Dr. Swain and the others mentioned that World Health Organizations recognize that in the Sri Lankan Sunday Times, you see that it's the first non-profit hospital, cooperative hospitals in Southeast Asia. So which is a commendable attribute. And our aim as a Global Friends of Moolai is to develop Moolai Cooperative Hospital services, fundraising the services in localities, expanding. Second thing is expanding medical services clinicals in northern Sri Lanka, supply more MCH centers, and Dr. Swain and me agreed on the village care centers, where that blood pressure to diabetic care to advice for the nurses and the others will come into play. The third aspect is cooperative development through global partnerships. I'll go into the details a little bit on the next few slides. And the Moolai Cooperative Satellite Clinics that IUI, the Fertility Clinics, Dr. Swain mentions in Main Street, 125 Main Street, and then Dr. Pulo and Dr. Swain and their team, Moolai Cooperative team, has visited Vaunia for the further development of another Northern Regional Center. Place care centers are existing too, and then just and the others are developing, and then people from abroad and the beneficiaries they are supporting these endeavors.
Can you mute everybody else, please?
Hello.
Can you mute?
Mute. Okay, thank you. Okay, our key development strategies, just like TIAM project spearheaded by Dr. Surain, the support economics, which is funded by well-wishers from outside, diaspora movements and things. So Global Friends of Molar Hospital, the fundraising entity, will work with the Moolai Hospital, trustees, and to help to establish clinics, Moolai clinics, and MCH clinics, regionals and villages. And why regionals and villages? Regional expansion is important because then it can be modeled, as Dr. Maniran said, this as a business model, not for-profit organizations, which can be duplicated in the other regions of Sri Lanka in the northern and the eastern regions. For that part, we need dependable service providers to work in these centers. So Dr. Pulanathan and we team up with Indian counterparts, and then to join venture MD trainees along with the Sri Lankan MD trainees, exchange programs for the nurses and the healthcare assistant being trained in Moolai and Manipur hospitals to work with us. In the Indian collaborations, I will just quickly go into the details and then things. AVMC medical centers and the possible the CTMRI that helps in our organizations which they have promised to that we have already had a MOU signed up. I will just quickly show everyone the AVMC Medical School, which is one of the largest in Pondicherry. As you can see in this one, that you can see they are Vinaya Missions Foundations, and they are willing to work with us. And they have signed up. They send during the COVID time. They have sent us the memorandum of articles, which we have to sign and return. On the next slide, I will show you the people that is going to be working with us. Is just here. This is the memorandum of article of associations of Global Friends of Molar. The Pondicherry partners is Mr. Lakshmi Morgan. He's one of the trustees of the health centers, and also he is a liaison for with the R. And they have put up a business plan, just like Dr. Manohar had mentioned, to put a laboratory, building up larger laboratories to CTMRI, so not-for-profit things. Then then we'll have to. They will come and provide a CTMRI so that, as Dr. Manohar said, just that patients don't have to go to Colombo, and we can do all the procedures locally in Jaffna itself. If anyone wants to look at Health United, you can have a look. And there's the largest organizations, with a couple of medical schools, nursing schools, and engineering faculties also. So I'm not going to go into the health now. So the Pondicherry associations, which we are working on at the moment. And Dr. Swain went through in details of all the services and things in our website, Moolai Cooperative Hospital website. People can go and look at it here. And family medicine services, specialty, laboratory services, and elderly care. all these things need to be further developed. You can see that one of our doctors, that provided funds to renovate the buildings there, which enable to move forward for the future. So in collaborations now with Institute of Family Medicine, with Rufulo, and the others, that the Main Street Moolai Cooperative Hospitals satellite center started now, and moving forward, Dr. Swain wanted to further develop into that, as Dr. Benno mentions, pharmacy and the other services along with the services. So which we can further develop with a good business plan. Okay. So with the history of Moolai and the Manika hospitals, which is two, I would say, sister hospitals, as one of the board members that you mentioned that here, that they were born in Moolai. I was born in Manipai. The entire family was born in Manipai. And then so I have been to Moolai hospitals many times with Dr. Swain independently a few times before the COVID times, and the improvements are happening. And then we liaise with Dr. Swain and the Moolai trustees started HCA training programs from here, teaching from the European Americans, mainly from New Jersey, New York, and the British doctors to teach, nurses to teach, once a week training program. But the Moolai hospitals, as just founded long time back in 1935, Dr. Kanagaraya, the Kanagaraya, that is graduated from Calcutta and worked in Singapore. He established a free clinics for local people there. It started with the small things, the same as the Dr. Alan Green that started 174 years ago. And then in Northern Ceylon Medical College was established in 1985, established as a private medical college, which later not carried through because of the war and then difficulties. If you look at the Green Hospital also, which is 175-year history, founded by Samuel Green in 1884, American missions. And then it's Mary Elizabeth Scott, and then they started the nursing training schools and renamed the facilities as William Pierce Nursing Schools. They're Canadians in modified nursing hospitals. So I think that Dr. Swain and their trustees have done a wonderful job in Modified, which we can duplicate and further grow as a regional center of excellence, which Dr. Swain's deep, very deep desire to do so. Okay. So if you see those that just haven't looked at it, I looked at online. There are some critics. They would say that yes, there are lack of facilities and things in Moolai hospitals. Yet our founding fathers are there. The both doctors from each hospital, Moolai hospitals and the Modified hospitals. And if you look at the rating at the moment in Sri Lanka at 4 out of 5, which is a really good standard. So if you can look on the other slides, I'll show you why that we need a global Friends of Moolai hospitals. The first friend of Moolai hospital was Swaji Ganesan. For those that all the Tamil people that we know that Swaji Ganesan is the most prominent actor. And then in 1958, he's one of the first fundraising person that fundraise when the people from South came with the rights and things, and then he provided. We could use similar model to attract funds, but in the meantime, we can generate our own funds to begin with. So as we see that it's a holistic care center. We want to build up a holistic care center because human beings should be treated not only as individual, psychological, and the region as a whole, and to treat the person as a whole. And need to have a trusted doctors, and then a high quality. The third factor is a high quality. If you look at the website, it's each for all and all for each. That's meaning that just everyone should help each other. So you see that Dr. Strange is an opening of the A&Es, the Molar hospitals, and the OR renovated back there. And also we got a really nice center to redeveloped. You can see the old OPD, which needs a little bit of touching up. For those that want to look at it, and then we have a website developed with a few of my IT helpers, and please, you can have a join with us there, and then continue to put the details and everything else, what we are doing it, so that we can do a proper propaganda things. So getting back to this one, this is what Friends of Moolai's application forms. So you can just go in here. General memberships only for £25 annually, and a few doctors already joined. And student membership £10, and lifetime memberships £100. And you could donate through if you could donate through PayPal by clicking here, and immediately you can donate, and then they deduct. I think that's which I donated £100, and then it's only come to £98 or something. So if you directly deposit the bank, if you're outside the UK, you can do it by SWIFT, BIC, IBAN codes for the Wise Bank, which is British Bank itself. So all the funds will be received in British pounds, and then when the funds we can transfer to Sri Lanka, the Moolai hospitals are much easier. Wise Bank has international transfer facilities with less transfer rates, better rates than the mainstream banks. Otherwise, anyone from UK, they can donate through sort codes and the account number. So that's conclude majority of my presentations. But if you look at, I'm going to go back and then touch base with this one aspect of it. The health centers, if you look at health centers, just briefly, I will just go through their what they do it. As Dr. Manoharan said, just we have to operate as business, not for profit. So they are multi-million-dollar industries from India: medical consulting, IT staffing, e-health solutions, scribing, digitals, medical transcriptions. They're doing it for all over the different countries: health solutions, pharmaceuticals, and IT, and everything else. So they can go and have a look at this ones and how they are doing it, and their medical schools and different things, and collaborating with them to bring about CTMRI to Moolai, and then to the Diabetic Center. Will be one of the key milestones we can achieve in short durations. So that is to, in addition to that, bring the MD trainees, bilaterals. They agreed to provide nurse matron for the Moolai hospital itself in exchange, 6 months exchange program. We give one of our staff, and then they will take them and then train them in India, vice versa. And then we send our MD trainees, and then they exchange MD trainees also from India. So which will be a really good prospect for the future of development, to expand the scope of, and to bring credibility with their outstanding credibility for the ABMC, Outpatient Medical School, and the health centers. We can move forward. Thank you.